So the floor is open to questions and comments, both in the room and on the web.
Hi, this is Tamara Coyne-Beasley. Thank you very much for some very insightful presentations and very sensitively done. It's very clear, we all know that there are economic incentives that cause young people to be incarcerated. One, I'd like you to talk a little bit more about kind of what those economic incentives look like. You mentioned a couple of examples, but if you could present us with the range of those examples. And then really, what is it that we can do as community members and as academicians and scholars and policymakers ourselves to change that, because it's absolutely unacceptable.
Well, the economic incentives are superficially clear, but then of course they're complicated because it's political, and there's so much political advantage these days to being hard on crime and stuff like that. But the main, the lobbying, the people who are paid to take those positions are being lobbied by folks in poor rural communities where jobs are scarce. And so they want prisons and want prison beds. In order to justify getting prison beds, you have to make the penalties for crimes harsher and harsher. And you have to restrict the funding for diversion programs and alternatives to incarceration. It is so hard to get drug courts. It is so hard to get mental illness courts where the judges know about addiction or they know about mental illness. It is so difficult to think about simple diversion programs for nonviolent people with nonviolent offenses where they can be home and wear a bracelet. I mean, all of those are profoundly less expensive than incarcerating them. So one part is speak out politically, but as academics, we can do the research to demonstrate what I think is true, is that frequent and long incarceration is worse in terms of safety and public health than better alternatives. Anybody else have thoughts about that?
Yeah, I just wanted to say a couple things. One is in the juvenile end of this, we have an industry, we have a treatment industry, and they oftentimes are influential in convincing judges what's a good program, what isn't a good program. And I think judges are becoming more and more skeptical, and I think public support for juvenile court judges to hold treatment providers responsible and accountable for what's provided to kids when they come into their programs is really taking off in the system, and I think if there's any opportunity to support that that viewpoint among local juvenile court judges, I think that'd be a great move forward. The other one is the one Bob mentioned is the mandatory sentencing stuff is just it's filling these places up, and that's a big issue.
I do think I should say for the record here that there are a lot of different views about what has contributed to the over-incarceration, and certainly the economic incentives and vested interests that people have in the system as it is one thing. Of course, that's not limited to institutions in the criminal justice system. It's the same issue sometimes for mental health and juvenile justice institutions, as well. So we understand that there are jobs at stake. But the other thing to be emphasized is, of course, there are other objectives aside from the public health, that the criminal justice system has. And as I said, it fundamentally does implicate the question about retribution and its role, and deterrence and its role. The crime rate has come down, right, over all these years, and there's a big argument about what accounts for that, and I'm not making the argument that it's incarceration, but there are some, of the scholars that have researched, this that says maybe the incarceration and the incapacitative effect that has had, has played a role in that. So there are other, factors at work. And then I think another thing to be said, because of the analogy to the healthcare system, is, and this is, I will say, I endorse about what I'm about to say here, is that nobody actually has, of the participants, police, prosecutors, judges, and people in the, say, the parole system, if it still exists, have the incentive of a global budget, right? So they don't internalize the costs of what happens in terms of this incarceration rate. And of course, politically, we're all paying that cost. But it's similar in the healthcare system, that nobody is actually internalizing the cost of not providing preventive care and so on. And so, one of the issues, for example, is there a way that you could actually set up in effect, this is the amount of money that we're going to spend, in order to control crime, and then, have ways in which the prosecutors, when they make a prosecutorial judgment, are taking that into account. So this, as you can tell, this is a very complicated structural problem that we have in the criminal justice system also. So it's a big topic.
The low-hanging fruit with all this would be the provision of better mental health care in the community and better options for prevention, identification, and treatment of drug abuse. Do that first, and the demand for prison beds is just going to go down dramatically.
I agree with most of the analyses I've heard just now. David Osher, American Institutes for Research. I want to go back to the youth contribution and the issue of school effects. And that we both know that schools there's an increasing body of data that suggests that schools can both have harmful effects as well as positive effects. And then at a policy level, there's increasing data regarding the criminalization of adolescent behavior within schools that is of great concern to an increasing number of judges nationally as well, and is really feeding into the things that you've been talking about. And I think that as we think about the issues that you're raising, I think it's important to really connect in that universal compulsory institution that exists in our society that could both be preventive in terms of doing a lot of things, including developing the relational and social emotional capital skills of kids and social capital, or on the other hand, be a place where you actually have that negative social norming occurring much earlier, and a set of push-outs and incidents that not only end up leading kids to drop out and enter the juvenile justice system, but actually criminalize them and have them develop warrants that then lead to incarceration.
I would just say I agree with that. And I think the schools are oftentimes the people who aren't at the table. And a lot of the meetings I've been in, it's always the educational system that isn't there. But there's a good bit of data about the importance of the school as a referral and a gate into the juvenile justice system, increasingly so in the last so many years.
Charlie Irwin, UCSF. I just want to say that the common theme I've heard today and yesterday in terms of the papers is substance use is a common pathway. And when you look at all the negative health outcomes, almost all of them during adolescence and young adult, they're co-associated with substance use. And there's new data that really would indicate that these, when you look at brains of early adolescents who have tried substances, they look different than young people who don't use substances. And I would argue that we need a much more robust system to tackle substance use. And with the legalization of marijuana that's unfolding in many states, and the whole process that if it's grown in the ground, it's natural. Poppies are grown in the ground too. I think we're in for some, if we think it's bad now, if you paint the picture of the future, it could be much worse. I don't know.
I think that's a really good point. And one of the things we need to think about is how to get rid of these siloed budgets. Prison and jail inmates have a prevalence of hepatitis C infection that varies across the country, but in no place is it less than 15%, and it goes up to 40%. So imagine the costs in a couple of decades for those 40%, those in the 40% states that have hepatitis C. How many liver transplants are we going to be doing? And the same goes for any of the communicable disease, it goes for HIV, it goes for just lots of other conditions that are preventable if we had the ability to prevent or treat addictive disorder better.
Yeah, we're going to have to call this session to an end. I think maybe it would be useful to end it, which is really grim, of course, you know, on a hopeful note. I mean, the costs of incarceration have been recognized, as you can imagine, in a period of austerity, and, you know, legislators are paying more attention to alternatives, including keeping people out of the prisons and supporting, you know, drug treatment programs, mental health courts, and at least in, you know, for those particular populations. So it may be the pendulum has gotten, you know, begun to swing back, but, you know, I think, you know, certainly the point of advocacy is a good one in order to keep that happening. So we'll go to the next session now with our young adult panel.